Well, good afternoon, everybody, and a very warm welcome on behalf of the British Thoracic Society and Respiratory Futures, which is a platform working to bring together the diverse respiratory sector to support integrated care, commissioning and innovation. I'm David Brindle. I'm the Public Services Editor at The Guardian newspaper, and I'm co-chairing this session with Dr. Jonathan Bennett, Chair of the BTS, and the title in your programme is The Long-Term Plan, A Respiratory Response. While that has a certain sort of Ron Seal clarity, it may not capture entirely, I think, the sense of excitement that respiratory services have won priority status in the long-term plan, and that the specialty is now really in the forefront. I nearly said vanguard, the forefront of fresh thinking and innovation around integration across the NHS, public health, and social care. John will expand on that in just a moment. But what we're aiming to do in this quite brief session is give you just a flavour of what's already happening by way of integration in respiratory services, and what more is going to be possible with that following wind from the long-term plan. As well as John, we're going to hear from Dr. Helen Ward, clinical lead for vertical integration at the Royal Wolverhampton NHS Trust, and Dr. Matt Evison, consultant physician at Manchester University NHS Foundation Trust and clinical director of the Lung Pathway Board for Greater Manchester Cancer. June Roberts from Salford Health had been due to join us, but sadly her mother's been taken unwell and hasn't been able to come, so our best wishes, of course, go to June. Should be good time for your questions and contributions after we've heard from our speakers. Rest assured we'll finish in good time for the Secretary of State, for those anxious not to miss him. But I can tell you without breaking any embargoes, because of course he's been trailing his speech quite widely this morning, that he's going to be talking about building an NHS that works for women. And spoiler alert, but no real surprise, you'll find the answer is digital. Smart digital rotors will become the norm across the NHS. In my remaining minute or so, let me just quickly sketch out some of the context for our conversation. As you surely know, the long-term plan sets out a 10-year vision for how health and care organisations should work together, taking collective responsibility for their local population health. All existing STPs are to become integrated care systems by 2021. Quite a tight timescale, I think, that will require some pretty nifty footwork, but require also a rather more rapid departure from the competitive market culture imposed on the NHS back now in 1991, and only really renounced in the 5-year forward view in 2014. And when we talk of integration, remember that the long-term plan calls for triple integration of primary and specialist care, of physical and mental health services, and indeed of health and social care. Will the picture in 2021 be a uniform one? No. There's going to be, I think, a great variety of integrated care systems at different stages of development, and indeed developing in different ways. There is no single template. But really that's the real opportunity, and it's one that respiratory services are already seizing as they tailor models of integration to local circumstance. We'll hear more about that from Helen and Matt, but let me introduce first John, hand over to him. As I say, he's chair of the BTS and consultant respiratory and general medicine physician at University Hospitals of Leicester NHS Trust. John.
Thanks, David. It's an important event because I've come in my suit, so thanks very much for coming. And to quote Bod from this morning, medicine's fantastic, but just remember, hashtag Resp's best. So the NHS plan's been a long time coming, and we feel at the BTS that it's been worth the wait for the respiratory community. Respiratory disease is a core component and thus a national NHS clinical priority for the first time. This shouldn't come as a surprise to anybody. After all, respiratory disease is the third biggest killer in the UK. It costs the UK economy at least £11 billion per year, and it's a key driver for both health inequality and also NHS winter pressures, many of us will still be feeling the after effects of. However, we have most of the fundamental structures to enable improvement and implementation of the respiratory plan already in place. We have a highly skilled, motivated and talented specialist workforce, albeit understaffed and overstretched. We have world-class clinical guidelines and quality standards, and we have a panoply of evidence-based, cost-effective treatments that deliver significant health and economic benefits, such as smoking cessation and pulmonary rehabilitation. We also have tools such as financial incentives to encourage best practice, such as sequins and best practice tariffs. We're at the forefront of innovative NHS practice, delivering integrated respiratory care, as we're going to hear about, and David's outlined, where patients can be treated closer to home. As we know with Map the app, we're going to be delivering digital technology that has the potential to revolutionise self-monitoring and shared management of lung disease. Thus, I think we have a real opportunity, and it is within our grasp. Our vision is to create the best respiratory care service in the world with the best patient outcomes, to change the concept of respiratory illness being the British disease. We can create a system that works seamlessly between hospital, community and social services, delivering on all fronts. That's prevention, diagnosis and treatment. So how can we achieve this? Well, I think it requires a three-part approach to the long-term plan and beyond. Firstly, we need to support the NHS in its delivery of the specific respiratory policies detailed in the long-term plan. This won't happen on its own. Policies, services need adequate investment, planning and evaluation, and the support of the respiratory and wider NHS and social care community. Our policies include diagnosing lung disease much earlier, including rolling out the innovative lung health check initiatives to high-risk populations. That's taking diagnostics, spirometry, CT scanning into the community, such as supermarket car parks, asking people who smoke or have smoked to have an assessment. This will help diagnose lung disease earlier, such as COPD and lung cancer earlier, and thereby saving lives, and ultimately reducing NHS and social service and societal costs. We need to expand access to pulmonary rehabilitation services. As a medic, I can prescribe any drug I want to, pretty much, but exercise medicine and specifically pulmonary rehab is much more limited availability currently. We need to make sure our patients receive and use the correct medication for their condition. I know this sounds stating the obvious, but often it's not done very well. I was going to say I could reference the nice guidance on how to use inhalers in children picture, but that may be a little bit being cheeky. Improving diagnosis and management of community-acquired pneumonia. We need to recognise those that are critically ill or at risk of critical illness much earlier, but for others, we can allow them to be treated at home with support. We need to ensure that all hospital patients who smoke are offered smoking cessation support by 2023-2024. We know that most smokers say they want to stop, and a hospital stay is a golden opportunity to offer one of the most clinically and cost-effective treatments. That's not only for lung disease, but for the patient as a whole, holistically. Stop smoking therapies and support should be the default. Secondly, we need to put forward a strong case for further policies to support the ambitions detailed in the respiratory plan. Suggestions could be a lung health or breathing assessment as a core component of the NHS health check for the over 40s, prevention and early detection have to be the ways forward. Thirdly, we face the elephants in the room regarding many aspects of the long-term plan. We heard a little bit about this morning. Workforce and capacity deficiencies. I would say that these are especially prevalent in respiratory services. We can see this across the board, and it's highlighted every winter, given that much of the winter NHS winter pressure comes from patients with respiratory illnesses. Approximately 4 in 10 hospitals in England have at least one vacant consultant respiratory post. The fact is that the UK specialty training programme is not training enough respiratory specialists to meet the increasing demand, but also the changing demographic of the workforce. Apparently Matt's going to sort out female robots later. There are similar workforce deficiencies in specialist respiratory nurses and allied health professionals. So the BTS is calling for an additional 100 respiratory training numbers to be created over the next 5 years, and for a national summit with NHS England and partners to address workforce deficiencies across the sector. The National Workforce Implementation Paper will be delivered later this year, and we're putting our case strongly, like many others, for increases in the respiratory workforce. We're also working with other professional bodies such as the RCP to try and address the retention of existing staff who are suffering with, to quote Bod, moral injury of the overstretched systems are placing upon them. To conclude, having a respiratory component to the long-term plan is a great platform for advancing respiratory care in this country. However, it doesn't add anything revolutionary, but this is good because much of what it proposes is already established as best practice. It needs to be invested in, scaled across the country and implemented effectively to enable access for all, and thus the opportunity for the best lung health in the world. The respiratory community has always been at the forefront, being both innovators and early adopters of change, whether it be integrated care, translating research into practice, or lobbying for key legislation on issues such as smoke-free public places. There's much positivity in the long-term plan, but it remains a plan, and we need to work together to ensure it becomes a reality at a local level in primary, secondary and social care. In these ways, the future's bright. We can make a difference and improve lung health across the nation. Today is a chance to hear about and celebrate some of this good practice from Helen and Matt. So thank you. I'm going to hand over to Helen. Thank you.